for the first one, by the time they're done, they should be at about 50%. It doesn't mean that they can't be beyond that, but that's kind of the minimum, is that 50%. And that's like with about 50% guidance. The caveat to that is some criteria require more. So like
Okay.
safety, professional behaviors, professional collaboration, those require more by the time they're done. They should be independent with that type of stuff by the time they're done. Let me go ahead and share my screen, because then I think we can talk about that a little bit more in depth. So this is something I'll send out, and I'll probably send it out beginning of next week. So this is the instructions. The first part, it kind of gives a list of all the criteria that you're looking at, like the performance criteria. The first four are critical. They're obviously really important. The first three are the ones that need to be higher for them by the time they're done. Clinical judgment is an important criteria, but it's harder. It's harder to meet those higher ratings. So we don't expect them to be as high on that one, but it is a critical part of their performance. That kind of just is a synopsis of all the criteria. And then down here, you get a longer explanation of each of them. I like this because I try to encourage clinical instructors to use these to kind of review when they're grading the students, but also each criteria has a comment section that you have to fill out, and you can use this language. I mean, I don't care if you even copy it word for word. If your student needs to do better at responding appropriately to emergencies, you can put that in the comment section. So it gives you ideas on what to put in the comment. I know it's kind of hard sometimes when you're trying to fill this out to come up with something. And so use this information that we're giving you. So each criteria has a longer explanation of what it entails. There's a good amount for each of the criteria. There's 11 criteria. And then we've got a rating scale. This has probably changed since you were in the program, but the basic premise is the same. We look at like maximal guidance, moderate guidance, minimal guidance. Maximal is 50 to 75% guidance, kind of like max assist, right? With a
Right.
patient, you're having to give them guidance 50 to 75% of the time. Moderate guidance is 25 to 50%. So I've got the maximal, moderate, and minimal guidance, and then I base it on kind of three levels of complexity. So if it's complex, if it's typical or routine, and if it's basic. And you kind of can judge what each of those mean. I kind of define it at the very end, but it's that three-level thing, right? A more complex patient or a more complex treatment technique, something that maybe they don't learn in school, or maybe they wouldn't even learn in a regular job, but it's more complex based on, a setting that they're in, or a specific skill that maybe you've learned in continuing ed or something, right? Like number three is maximal guidance for basic techniques and caseloads. Okay, so basic skills and caseloads. If they're maximal guidance for something that's basic, then they probably would need to be, more than maximal, greater than 75% guidance for something that's typical or routine. That's generally the case.
I have a question.
Yeah, go ahead.
So when we're scoring them, do we have a separate section for basic, advanced, and routine that we can score them on?
So
Or
yeah, each of the ratings kind of hit that. So rating 3 is for basic, maximal guidance for basic, and then rating 4 is moderate guidance for basic. Rating 5 is when you get into the typical and routine, because for 3, if they're maximal guidance for basic, then you can't really rate them on typical or routine. Number 5 is maximal guidance for typical or routine. Well, if they're maximal guidance for typical or routine, then they're probably moderate guidance for basic, less guidance for basic situations, right? So they would be 5 here, because they're 4 and 5. Now they might be moderate guidance for basic, but more than maximal for typical or routine, right? They might need more than that maximal assistance for the typical or routine. And in that case, you can grade them here because they they only need the moderate guidance for basic, but you can't grade them here because they're needing more than maximal. So
That
as
makes sense.
you get up into 6, it's minimal guidance for basic, then moderate guidance for max or for typical or routine. And then in 8, you get that maximal guidance for complex. But again, like so this is a basic, number 6 is basic, number 7 is typical or routine, and number 8 is complex. Well, they might be all 3 of these at the same time, but you would grade them at 8.
They should be able to do the others as well.
Yes.
And that, okay.
And if they can't, I think it's less likely that that's going to happen. But if they can't, then you can grade them lower. I think it's more likely that they're going to be moderate guidance for typical or routine, but may not be, to the point where they're able to do complex stuff without you really being in charge of everything, or the majority of everything. Maybe for a complex situation, they do a very small amount of what needs to be done. And so it's more than maximal, right? It's beyond that maximal. So you might only grade them at 7 because they can do the typical and routine stuff with moderate guidance, but they need more than maximal for complex. The other thing I want to point out is I've highlighted how much of a caseload they should be handling. So at 5, they should be about 25% of a caseload. 6, they would be between 25 and 50% of a caseload. 7 would be about 50%. It's not an exact science, but hopefully it can give you levels of where they're at. Now, that brings up what a normal caseload is. I kind of define it down here.
Non-complex caseload.
Non-complex caseload, and the caseload that would be expected of a new graduate PTA getting their first job at your site. A new grad would be getting a job at your site. So you can kind of look back at what you were able to handle when you first started. That's what that normal caseload is. Okay. Now, in some settings, it's hard to have a normal caseload. Let's say you're seeing 10 patients now, with how many years experience you have. I don't remember how long ago you graduated.
2.5, coming up on 3.
Yeah, 3 years. Okay. Let's say, I don't know what you're doing, but let's just say you're doing 10 right now, 10 patients a day or 10 treatments a day. I know in inpatient rehab, you see the patients twice a day.
Yeah. So our typical caseload, we have 4 patients throughout the day because they each get an hour and a half of physical therapy.
But you're seeing them twice. So you're essentially doing 8 treatments a day, right?
Yeah, that's true. That's good way of thinking about it.
That's kind of what I would look at is kind of what you're doing now and maybe reduce it just a little bit, maybe down to, so let's say you're doing 8 treatments a day, maybe expect a new grad to be doing 6 treatments a day or something like that, 3 patients a day. But really, for this first one, since it's her first, she really only needs to be at this 7, which is 50% of a caseload, moderate guidance for that 50%. Doesn't mean she can't be beyond that. She might actually, by the time she's done, be beyond that. But for this first one, that's the minimum she needs to be at for most of the criteria, except for those first 3, like I talked about: safety, professional collaboration, and professional behaviors. I do have the minimums at the midterm, which for those first 3, they need to be at this 7 by the midterm. So they need to be moderate guidance by the midterm by about 4 weeks. The rest of them by the midterm, they need to be, what's at 5, 25% of a caseload. So maximal guidance for typical and routine and 25% of a caseload by midterm. And I'll have that in the syllabus that I share with you. But again, sometimes people don't look at that and they rate them too low. I think that's all regarding this rating system with physical agents and modalities. For the first clinical, I do require that they get higher on that if they're in an outpatient type setting. This is the only one that you can rate not applicable. So in your clinic, if you don't use physical agents or modalities, then you can just put not applicable for it. The rest of them should be applicable for any setting. For the other clinics, like outpatient orthopedic clinics, I do expect them on their first one to kind of be the same with those first three on number A, because they've learned all this material. So they should be at 7 at the midterm for 8 and entry level, because if they're in an outpatient clinic for their first one, they might not see physical agents on their second one. And I want to show that they've achieved entry level for their first one. The other thing I want to talk about, and this is a lot more applicable to your setting, is the interprofessional collaboration. So again, with your student, she'll do outpatient orthopedics on her second one. So for this first one, it is critical that she shows that she can work with other disciplines like OT and speech and nursing and even the doctors, because in an outpatient clinic, it's harder to get that interprofessional collaboration. And that is under the third one, which again has to be rated higher. So that's where you grade that interprofessional collaborations under number 3. Anyway, I think that's all for that. One thing I want to just encourage you to do in the short amount of time that we have, the biggest thing I try to encourage for clinical instructors, especially clinical instructors who haven't had a student, is communication. Don't be afraid to give her, constructive feedback, help her become better. Students sometimes struggle, they might get a little defensive, but that's part of this learning experience, right? Is to learn how to receive that feedback and improve themselves. I see some clinical instructors are afraid to do that, and there's no way a student can improve unless you're giving them that feedback. And then don't be afraid to communicate with me. I'm here to support you. I'm also here to support the student. So I kind of have to juggle both sides. But I'd rather you communicate if there's kind of an issue when it's smaller versus wait until it's bigger. And even if that's like, hey, this is something I'm seeing, via email, I don't want you to step in and address it yet. I'll try to handle it myself, but I wanted to let you know what's going on, because I'd rather that than find out that there's this big problem after it's blown out of proportion. I'd also encourage all clinical instructors to write stuff down, because if it's in writing, and I know it's more documentation, but if it's in writing, it's easier for me to see that you've actually communicated that to the student, and preferably have the student sign it. So if there's something you really want the student to work on, write it down and have them sign it, kind of like a goal. And yeah, like I said, feel free to reach out to me. I will be doing a site visit, and that a lot of times is a good time to kind of bounce stuff off of me, and I'll review some of the expectations and stuff like that. But
I did think of a question. So they're supposed to have weekly goals, right? If I remember, I had to do that. Are they supposed to?
so it doesn't have to be a weekly. I think that's great if it's a weekly thing. They have to have 8 goals.
Okay.
So there's 8 weeks. If they do one per week, that would be ideal. I do make them do a discussion forum, and in the discussion forums, they have to kind of say what they want to work on for the upcoming week. But I think when you were a student, I might have expected the clinical instructor to kind of sign off on that. And I've taken that out of the hands of the clinical instructor a little bit, so that they don't have as much to do. So it's more on the student that they have to do that. It's a good question. But like I said, the 8 goals, they could be on, this is what I want to achieve by week 1. This is what I want to achieve by week 2. And you can edit them as you go too. I think you remember that from when you were a student. This is different. I do have them review them with you at the beginning, and then have you sign it saying they reviewed them with you, and then turn it in that first week. But that doesn't mean you can't change them, or the student can't change them before the time they're done. So I just wanted to kind of review this checklist on what the clinical instructors need to do. And some of this stuff, or most of this stuff, is for the students, but there are some things that I need clinical instructors help with on some of it. And I kind of already mentioned this, but the students should have written 8 clinical goals down before they start. And I want you to take some time during that first week to review those with them, because they don't understand what is expected at your clinical site. And so you might have to adjust some of them based on what can and can't be done at the clinical site. So I do have the students get a signature from you saying that they've reviewed that with you, and then they have to upload that. This stuff, the weekly reflection forms, that's just for the students. They might ask your feedback, because I do ask them, what did you do good this week? What are you going to do better? Or what do you want to work on for the upcoming week? And so they might ask for your feedback on that. Again, I would encourage you to have kind of a debrief or something every week at least, where you're just talking about how the week went as a whole, so that they can kind of get that information. It's a good way to communicate with the students and give them ideas on what they can improve upon. Please be sensitive to the students too. I mean, it is hard to hear, you're not doing good at this, you're not doing good at that. So, you can do the whole compliment sandwich, where you tell them what they're doing good, what they can improve on, and then something else that they're doing good. Or, even if it's just one thing they're doing good or one thing that they can improve upon, try to balance that out, so you're not just hounding on them on everything that they're doing bad. There might be more than one thing that they can work on, and that's great, but just try to balance it out with stuff that they're doing good. They might still get defensive, and if that's the case, let me know, and I can try to talk to them about that. Try to respect them and understand that they're in a stressful situation. Like, remember how you were when you were a student on your clinicals, and show them the respect that they deserve. You got to do the midterm, and we kind of already talked about that, and the final. Okay. There are expectations listed in the syllabus, those minimum ratings. Okay. So make sure that you're following those, and then make sure that you're putting a comment in every comment box. A valuable comment, not just doing good. I'll send that back to you if I don't have a valuable comment. Again, students can't improve if you don't communicate with them. And so giving them something in that comment to work on, in those comments boxes to work on, is going to be very valuable to them. Again, you can put stuff in those comment boxes that they're doing good on, but be specific. Don't just say doing good, because that's not going to help them. They have to do an in-service, a journal article review. That's typically, it depends on the site. So I don't have any rubric or anything like that for what they have to do. It depends on what you would expect them to do. Okay. I do want it to benefit the site though in some way. So if they do like a presentation, hopefully it's on a topic that the clinical site, the clinicians there want to know more about or need to know more about. The student is going to learn no matter what. So the tendency sometimes is to give a topic to the students on what they need to know more about. They're going to learn no matter what they do. So hopefully it's a topic that also the clinicians at the site would like to know more about. Usually a presentation. Some sites might have a 15-minute long presentation. Some sites might only have time for a 5-minute presentation. They can do, if you don't have time to let them do a presentation, then they can do a journal article review, where they review a journal article or a topic, and then I do want them to create something like a handout that they can give to the clinicians that kind of gives a synopsis of that topic or that journal, that research that they did. So preferably something that benefits the clinicians at that site, at your site. I have had students, and I'm okay with this. Again, it's kind of up to you, but I've had students or sites, it's really the sites. The students need to do what the site expects of them. But I've had sites where they have students do like a project of some sort. So an example would be like in a skilled nursing facility, I've had students like measure around the hallways and put marks like on the baseboards of the walls to know how many feet you're walking when you walk with a patient. I've had students create, like at a pediatric clinic, build something that they needed to help with treatments for patients or something to that effect. So those type of projects are okay. In general, they need to do something that benefits the site. I do expect them to get 40 hours a week. This is an accreditation thing, and they will be sending you timesheets that you have to sign off on. on Exact. You'll get it in the email. Just give a link. You don't have to sign into Exact. You just click on the link and it will take you where you need to go. They are expected to do 40 hours a week. If you struggle with getting them 40 hours a week, then let me know. There's some things we can do to try to help with that. There's some ideas that I have, but please let me know in advance so that we're not scrambling at the end. They need a minimum of 304 hours. That's on average 38 hours per week. But if they miss any days, then they need to be getting 40 hours a week or more, because that allows them to miss a couple of days and not have to make it up a couple of 8-hour days. So let me know if that's an issue. And then at the end, it's not on this checklist, but I'll ask that you do kind of an evaluation of me, an evaluation of our program kind of through the lens of the student and how prepared the student is. Just remember that this is the student's first clinical affiliation, and they might need to start slow. I appreciate your help. I know it takes a little bit of extra time to kind of help teach the student, but it's so valuable. I mean, this is how they learn how to work with real patients. We can't do it in the school setting as easily. And so please be patient with them and understand that this is their chance to learn and grow and become a better clinician. So I did want to just mention, I should have mentioned this kind of at the beginning. I am going to be sending out a DocuSign saying that you've reviewed all the materials that I send to you next week, including this video and including the syllabus and the clinical education manual and the instructions for the performance eval, which I was showing at the beginning of this video. It's this instructions, the CSPE instructions. Accreditation wanted me to demonstrate that you have received the materials and reviewed them. I will have you sign something saying that you've done that so that we know that you understand the expectations of clinical affiliation. Hopefully, if there's any questions, reach out to me. I'm available. I love to help. That's my job. Hopefully this helps quite a bit. Sorry if it's too long. I'm trying to make it as easy as possible for everybody. Just know that these materials are for your use, and I do need you to review them as best as you can. Anyway, reach out if there's any problems, and thank you.